Welcome. Today we are live at TD Studio Hall. Today we have very important title. Of course, don't go away. We will be blown by the health practitioners that are going to be speaking to you today. My name is Mwale Tochi, and of course my co-host.
My name is Michael, and I'll be co-hosting for this program. And we have a fantastic program for you. It's health talk. So we are going to be keeping our clients, our audience, the free tips about their health, what they need to know about cardiovascular diseases, hypertension, and diabetes, the preventive measures, and how to manage silent killer.
Fantastic. You've heard it from my co-host, Mr. Michael. The title of today is The Silent Killers. Of course, we have seasoned health practitioner, Olubimi, will be handling on that important health challenges of hypertension, diabetes, and of course, cardiovascular diseases. Of course, a healthy nation is a wealthy nation. You know the importance of health, and that's why at TD Studio, we are very we attach importance to the health-related issues. And that's why we have chosen this important date to speak with those who are the practitioners. So what are you going to benefit today? You're going to see the doctors and the nurses will be talking about the signs of those diseases. They are not deadly diseases. Prevention, as they say, is better than cure. So that's exactly what you'll be listening today. Of course, lifestyle. Health is a lifestyle. Some of us do not take our health so serious. You need to be with practitioners so that they can be guided. Of course, the practical tips for those how to manage those conditions. Once you have the symptom, then you know where to go. Your doctor, or your nurse, or your practitioners. Health is wealth. So, is our speaker on standby now? Olubimi and Dr. Olga Anthony are there right now?
Okay, I think we have Nurse Olubimi on the studio now, and I think Nurse Olubimi, can you hear us? Please, can you just say something briefly?
Just say something. Can she say can she hear us? Say, if you can hear us, just say yes, and then greet our audience all over the world who are waiting to hear from you today. Can she hear us? The podcast today is very important. The program, of course, we're waiting for Olubimi. Olubimi looks like she has a technical problem joining us. Michael, can you confirm, or the crew, can you people find us? Is she still on this studio?
I think the next one is Lamin, and but she's on the studio here.
Can somebody chat with her so she can you chat so she can at your right side? She's on this meeting, streaming live from our studio, of course, away are not health practitioners. We have those who are health practitioners is going to be addressing the question we have, of course. So many other questions that the serious burden of hypertension and diabetes in Nigeria today, and invariably around the world. So it's not peculiar to Nigeria. So should I start should we start our questions or what?
Yes, she can say something so that we can know she's there with us. We can see him, we can see her on the studio,
Yes.
live and direct. So, Nosolubume, can you hear us?
While we are resolving the technical problem for our guests, possibly fluctuation from our location. So we want to educate some of our audience. Of course, you need to take your health very, very serious. Okay, so we wanted to make sure that the practitioners who will be giving you, because we're not permitted by law to say anything that we are not competent, and that's not our area of competency, so I will not speak on that health issue or advise you on your health, but I can as well tell you the basic health that you should take, which is hygiene. So we all remember during the time of COVID 2019, wash your hand, wear your mask. Do you remember those slogans? Michael, do you still remember those slogans?
I remember.
Wash your hands, wear your mask.
that was COVID-19.
Yeah. Yes.
Program.
Yes.
You wash your hands.
Wash your hands.
And you practice your personal hygiene.
Correct.
Use your nose mask.
Yes.
And also clean your hands properly. Health is important because health is wealth.
Fantastic.
So many people, it's by the grace of God that we are having a sound health. People are there that probably they have listened to this kind of program or this kind of they have gotten this kind of opportunity to be on a program like this.
Yeah.
To know more about how to handle their health. Probably they will not be in the hospital now. But we are not saying that they are not doing well. But at the same time, we just information is the key.
Right.
So you need to know everything about your health and
yes.
so that you can prevent some certain things that will give you an healthy life.
Correct.
So when you have an healthy life that you can say you want to look for money, you want to do whatever you want to do in life.
Absolutely.
So, exactly. So
absolutely.
Exactly. So we cherish our clients and we cherish our audience. We love them, and
yes.
that's why I'm giving them this free of charge.
Yes. By next week, we're going to have powerful doctor. One is from UK.
Yes.
He's supposed to join us today. Dr. Sonny will be joining us next week live streaming from TD Studio Hub. Of course, if you are watching us on our bio, join, click, like, share, comment, because we're going to be bringing you from the health practitioners all over the world, from Africa to UK to Canada to US, Australia. They're going to be speaking one thing, one language: health, your body, your health system, your everything, totality of your health. That's exactly what you're going to be hearing. So I want us to draw your attention while we're waiting for Nurse Olubumi, the health, community health. So I want to say something, which is to draw the lessons we learned during the COVID-19. We wish it never happened. It was like the end of the world. And then the negative impact of COVID-19. I remember I wrote my book, second book. It's my second book during COVID-19. Mike, do you remember? I wrote my book. Don't go out. Don't shake your hand. Don't shake your hands. I was able to write my second book on Amazon.com. You can find it. So the thing I'm trying to say is that a lot of companies started thinking outside the box. In fact, do you remember Zoom? Zoom made fortune.
Exactly.
Till today, Zoom that know from the those in educational background, educationists, to business, virtual meetings. The technology bloomed and become skyrocketed. Subscriptions, people cannot meet, conferences cancelled, flights cancelled, meetings paid, hotels shut down. Almost all the hotels around the world were turned to COVID-19 facility. Michael, did you still remember that?
I remember vividly.
Okay.
Because there are some times that if nobody is expecting something like that, because if someone something like that, the experience we had about COVID-19,
correct,
would happen.
Yes.
Nobody will ever believe that because everybody was stranded. It was a very terrible experience.
Absolutely.
Across the whole world.
Absolutely.
So, and thank God for the mercy. We thank God for the grace we have now, and thank God for the great health and sound health that we have now.
In fact, it was one of the pandemic that scared the politicians. They don't want to meet again. I remember then the late President Buhari. Buhari shut the door of Azo Rock. He couldn't allow anybody to come in. Distance. The fear of COVID-19 was the beginning of wisdom. No more politicking, no more defection. All they care is how they can survive because they don't know who is going to die next. But God is good. And then that's why sometimes we need to look at how God has been so kind. For some of you who are still not believing whether there's God, you need to think. Michael is still atheist who does not believe there's God. They need to go back to that history. I'm sorry, I don't know whether one of our audience may be an atheist, but you need to go back to history. If not for God, even those who do not believe God started praying. Yes, they are walking on the street, they are praying.
Exactly.
Okay, so everybody, no Christians, Muslims, Buddhists, and all the kind of Judaism, we turn to God.
Exactly.
One language is survival. Okay.
So we have our guest now.
Okay.
On the podium.
Right.
We have Lost Olubume on the studio now.
Fantastic.
Lost Olubume, you're welcome.
Thank you, sir. Good afternoon, sir.
Good afternoon.
I'm happy to see you. We've been firing on a layman's language. Of course, we're now health practitioners. By our competency, that's not our field. So we have Madam Olubumi, is the community health.
Yes, sir.
Am I correct?
Yes, sir.
Okay.
Yes, sir, you are correct, sir.
Okay, so my name is Smali Tochi. I'm your host today. And then Michael Oyilade is my co-host. So can we know you? Tell us your name. Our audience are longing to see you. And we know today, don't forget the title of today, which is the health challenges. What's the title again, Michael?
The title is Cardiovascular Diseases,
Absolutely.
Hypertension, and Diabetes.
Yes.
So we want to be opening our audience eyes to the prevention and how to manage this silent killer, which is diabetes and hypertension.
Yes.
So the early warning signs,
Correct.
we should never ignore.
Yes.
The lifestyle changes that can save lives.
Correct.
Practical tips for managing these conditions, long time, and why community health awareness is the key to the prevention. So we want you to please educate our audience over there, all over the world.
Thank you, Michael, for this introduction. Like you said, live health talk show. The podcast today is streaming live. Olubumi is a community health practitioner. She's here live with us. Wherever you are tuning in, this is TD Studio Hall. We want to make sure that you are healthy. A healthy person is a wealthy person. So that's why this topic today, we're going to be doing it. Next week, we'll be having another practitioner who's going to be speaking. So without wasting time, we want to start with our first question, which is, can you tell us about your background, your biography, and then your family background, Madam Olubumi?
All right, sir. I am Aware Oluwanifemi Olubumi. born on the 24th of January 98, into the family of late Mr. Raphael and Mrs. Florence Awe at Akoko, Akure North, Ondo State.
Thank you for that wonderful introduction. We are happy to have you, and we can't thank you enough for sparing your precious time to share how we can handle some diseases of hypertension, diabetes, then and other things. So, and then we go to the next. What inspired you to be a specialist on cardiovascular health, and of course other health knowledge or certifications that you've acquired? What exactly made you to journey into that arena?
So I had passion for this work right from beginning. So I want to be saving lives, and I have innate desire to help others. That's why.
Wonderful. This is a compassionate and a passionate desire. Many of us have gotten into a profession that we do not have passion for it, and then we end up not happy. Some not really. I don't want to use the word regretting it, but not happy while doing the job. You hear from Madam Olubimi. She wants to save life. Madam, thank you for wanting to save life. This is a very good sacrifice. So, how serious is the burden of hypertension and diabetes in Nigeria? From your records, and of course, the patients you've attended to initiate, so that those who are listening will be able to understand how grave and then this thing called hypertension and diabetes.
Hypertension and diabetes are serious and are escalating public health crisis in Nigeria, marked by high and increasing prevalence, especially in urban areas, leading to devastating complications like heart attacks, strokes, and kidney diseases.
Okay, you hear it from the mouth. This is a serious crisis in the whole nation, not only Nigeria, but all Africa and all over the world. Hypertension and the diabetes are very serious. Madam, let me follow up with that question. Are there deadly diseases?
What did you say, sir?
Are there deadly diseases?
Are they deadly diseases? Are they deadly?
Yes, sir. Yes, sir. They are most time deadly when not treated on time. Like concerning the diabetes, some people they don't know they have diabetes. So, and the only way they can know they have the diabetes is number one, you'll be feeling frequent taste, frequent hunger, like hunger, having the feeling to eat almost all the time. But they did not put, they are not aware of it that those are the symptoms of diabetes. So it is now when they now have wound, maybe they just have little bruises, and the next thing it starts spreading. Who starts spreading? So before they get to the hospital to confirm it, it should have been worse. It should have lead to gangrene. So that is the more reason why that diabetes can kill on time. But if they are aware and they know that okay, they have diabetes already, they'll know okay, they have to prevent it or they have to manage it, that by using their drugs, or they should not even eat or take anything that will trigger it. Then for the hypertension, most people used to have this headache, tingling sensation, but they are not aware. They did not put their whole mind and soul in it because they feel it is normal. So I think this maybe is typhoid. And meanwhile, they are becoming hypertensive. They don't know. So the only way they can help themselves is by reducing their excess salt intake in food and quitting alcohol, smoking.
All right. Thank you very much, Nurse Olubumi.
Yes.
And my question: what is the causes? What are the causes of these diseases, hypertension and diabetes? What are the causes?
So So the causes of hypertension are: number one, stress. Stress is the number one cause of hypertension. Then most
Okay.
times, high sodium in food, like high intake of salt, also causes hypertension. Not sleeping well can also cause hypertension. And there are some drugs that ought not to be taken, that people are taking, that causes this hypertension. Then for the diabetes, though both hypertension and diabetes, they can be inherited from family, that is family history. Maybe they have it in the family, so it can also cause it.
Wonderful. Wonderful. So it's hereditary.
So are you saying hypertension is hereditary?
Yes, it is inherited.
Oh, okay. So what's the difference between hypertension and diabetes?
Okay. Hypertension is the increase in blood artery. Then why diabetes? Can you hear me?
Yes, I can hear you.
Okay. Diabetes is the increase in insulin in the blood, like the increase of insulin in the blood.
Okay.
Okay. Can you just explain more better? For those people that doesn't know that doesn't understand.
Yes.
We are not in the health line.
Yes.
We don't know what is insulin. We don't know.
Yes.
So
in the layman's language.
In the layman's language.
Okay.
Like our old parents.
We have old mama. We have
yes,
old
and all that. Yes.
Right. They are watching.
Yes.
Okay.
How do they understand this?
Okay. Insulin is the main factor for diabetes. So some things usually triggers it to make it increase, to make someone to be diabetic, which is food, like eating starchy food, like food that the end product are glucose. Excessive of it can trigger that insulin and make it increase.
Okay, we can hear you. You said excessive food can
Starchy
increase,
food.
can spark,
Yes.
and increase the
Yes. Yes.
And starchy eating amala.
Yeah, amala,
Yeah. Like
those kind of food.
semo.
Yes.
Would eating it late also trigger it? Like somebody eating late. What time exactly are we supposed to be taking our dinner when we want to eat heavy, starchy food? Like carbohydrate. I'm trying to.
What is the best time for us to, eat
heavy starch?
Dinner, even the starch and all of that.
Yes.
To my own understanding, the best time to eat dinner is from 4 to 6 p.m. So that even if you eat food that is as hard as rock, at least within 3 hours, it's going to digest. Some will have sound sleep.
Okay.
You guys have heard it. Do not forget to like, comment, share. Invite your friend to join. Link on the bio section. Ask questions. They can ask questions, right? On the top button for
Yes. You can ask your question on the comment section.
Comment section, exactly.
So we read it out. I think someone is asking a question.
What's the question?
Bayo is saying that he said, how important is exercise for heart health and blood sugar control?
Okay.
So how important is exercising our body for
exercise is extremely
blood sugar control?
Exercise is extremely important for both heart health and blood sugar control, acting as a powerful independent therapy to prevent and manage conditions like cardiovascular disease and type 2 diabetes. Though regular physical activities strengthens the heart and it lowers blood pressure, it improves cholesterol and increases insulin sensitivity, and helps cell use glucose more effectively and reducing overall blood sugar level.
Fantastic. This is very important education that especially people who are from the third world, we do not have much education on our health needs. Of course, the government is not, fortunately, not doing much in that regard. Unlike the Western world, which is a health priority more than anything. So some of us do not have health insurance and don't know how many people in the third world, especially in Nigeria or African countries, have coverage of health insurance. Unlike what obtained in the US, Canada, or probably other Western countries in Europe, where health insurance covers you, and then of course your immediate family. So what we're talking about here is self-health consciousness. We want to make sure that you listen to Madame as she explains. For some of us who we know we eat heavy, starchy food, especially in the evening, she has said it's not advisable. Your health-wise, it's not advisable. From 4 p.m. to 6 p.m., that's what the practitioner, Madame Olubimi, recommended, so that you have the digestive system can be able to resist those things down. But Madame Olubimi, from that 6 p.m., yes, from the 6 p.m., what kind of food should we be taking? What kind of thing intake? Let me not say food. Yes. This one is very important.
Light food.
Yes.
Light food can be taken. Maybe like tea and bread.
Okay. Okay. About something like yam is also very starchy as well.
Because is it just bread and tea?
No,
or do we have any other food?
Plantain and egg can also be plantain and egg, but the food must not be egg, just light food.
Oh, okay. There is another question from Wale. Wale is saying that what are the early warning signs of hypertension and diabetes people often miss? Said, what are the early warning signs of hypertension and diabetes people often miss? What are the early signs?
Early signs of hypertension or diabetes people often miss are, for the hypertension, tinnitus, that is ringing in the ear.
Okay.
Then, and slow healing sores or darkened skin patches for diabetes. Then for the hypertension, other includes blurred vision, like someone seeing blurry, headaches too, when someone is feeling dizzy. Then for the diabetes, increased taste and hunger or frequent urination.
Okay. Wow. Okay. Those are the symptoms.
So, can you tell us an experience you had with probably an hypertensive and diabetic patient, and how you were able to manage it with that person and also help that person for a good healthy life?
Okay. For my diabetic patient, so after I complained, like she complained to me, then I did some tests for her and I confirmed that okay, she was diabetic because I cannot just give her drug because she complained or her symptoms seemed like she's diabetic. So I did tests for her. After doing the test, then I confirmed that she was diabetic. Then I placed her on oral drugs. Used to call them hypoglycemic drugs. They reduce blood sugar. And I told her what to eat and what not to eat. I placed her on eating vegetables and fruit more often, and allow her cut on carbohydrate food. Then while for my hypertensive patient, after checking her blood pressure, I detected that the diastolic was high, the systolic was high. So I placed her on oral drugs too. I told her to engage in some exercise, some aerobic exercises. Then I told her to be coming for checkup every week. and now they are fine.
Okay. Thank you very much.
Well, thank you for sharing that experience.
That's a very nice experience.
Yes, a very good one. So, my mind raises to another question, which is, does it have any age or anybody can have this disease?
Yeah, anybody can just develop hypertension or diabetic if it's in the family history.
Okay.
And it is mostly high in men than women.
Okay.
So it mostly occurs on women that are in their menopausal age.
Okay. Okay. So the woman, can you explain more on what you mean by that?
Okay.
Yes.
So women would have gone through stress, like maybe during childbirth, stuff like that. There are some hypertension that are caused, that are pregnancy-induced hypertension. The hypertension usually occurs when they are pregnant.
Yes.
So after escaping it, maybe after childbirth, it becomes normal after some medication and the like. Then when they stop giving birth, it can later occur after they might stop menstruating. So the women that have stopped menstruating, they are the ones that are called menopausal women.
Mhm.
So it occurs at that stage.
And what age from what age to what age is that?
From 40 years upward. Like some women at the age of 35, they're already in their menopausal age. Maybe due to
Okay.
the contraceptive they're taking.
Okay. Okay. So in that, what's the name of that disease or disease that women menopause?
Menopause.
Okay. All right. Okay. So in cardiovascular disease, so what are the risk factors in that particular disease?
The risk factors.
Yes.
Young women, young men, they are most risk factors of high blood pressure. That's the
Okay.
hypertension.
Okay.
Because of stress, one, and some of them they take alcohol. They consume
Okay.
hard alcohol. Yes, and their hard drug they are taking usually
Okay.
affect them.
Okay. Wow.
Thank you very much, Nurse Olubumi, for this fantastic section.
Yes.
And please, our audience over there, don't enjoy this program alone.
Yes.
Just keep sharing. Share
Yes.
to your
Keep
colleagues. Share to
Show
your
love.
friends.
Show
Show
love.
love. Don't.
Don't hate it, but don't be selfish.
We are giving you free. Give them free.
That is pouring all that she has for over how many years right now? How many years have you been in this industry, madam?
8 years now.
Imagine.
Wow.
8 years of experience.
Fantastic.
And taking for free.
Okay.
If you go to USA, you'll pay millions because it's going to be in thousands, but here it's going to be in millions. Okay, so just to have your CPA, check up on you takes a lot of money. To even have health consultation, they call it consultation. It's a lot of money. So we're doing this for humanity. And you heard Madam Ulukmi, she has passion for lives, to save lives. So everything is not money. For you guys that think everything is all about money, if it is so, maybe a lot of us, over 8 billion people on the planet Earth, maybe one few individual would have bought the whole life. But unfortunately, money cannot buy it. And they cannot buy it. That's why one of the reasons why we need to serve God. Okay? So we need to believe God because it's only God that has the right to take away lives.
Exactly.
You know, so they that's the life with complete control over that. So, Michael, what is the any person again from our audience?
This Sola said, how can government
Yes.
and private sector partner to reduce this disease? How can they partner together
Yes.
to reduce
Yeah.
this dangerous silent killer, cardiovascular
Okay.
disease?
By them working hand in hand, because there are some doctors that when they have this case, they know that truly they cannot go. Instead of them to refer or call other doctors like specialists to assist, but because of greed and because of the love of money, they won't. That's why I say working hand in hand. Then by referring this disease to specialists, people that they are based on it only.
Okay. I'm listening.
And awareness too should be created. And there should be free health care.
Okay. And then the free health care, there are two things you said here that are very important. And how I wish, because I was it early this year, I read that Nigeria government, the past presidents and the current
You-
president.
As we are speaking,
Yes.
Dr. Oyelade Taiwo
Oh, he's on.
is on
Oh, wow.
this section with us, and Dr. Oyelade Taiwo, you are welcome on board.
Yes, I'm with you.
Thank you, Dr. Yalade. Of course, your namesake and your brother is here. I'm Tochi speaking to you. I'm the host today. Okay, and we're grateful for you to spare your precious time to join us today. So we want to we'll be with you in a minute. I want to I'm still talking with Nurse. I remember she talked something so profound, which is the awareness campaign. Of course, that's where we are not getting it right in Nigeria, especially third world. So the awareness campaign, I remember reading that from the past president to the current president, they've spent over $1 billion. I don't know whether I'm right. That's for medical treatment, tourism. They call it medical tourism. So when you look at this, what we're talking about is many diseases, many people who have died as a result of lack of information and awareness campaign to be able to identify the cardiovascular disease, and of course the hypertension and the diabetes. So we want to, Madam Olubimi, how can people reach you if they want to connect with you? How do they reach you? Because a lot of people are on this program and they're going to be watching it on our YouTube channel, and all other Facebook, Instagram, and all the other platforms. So how are they going to connect with you? How are they going to connect with you to be able to reach out to you? How are they going to do that? Madam Olubimi, did you hear me? Is she there? Is she there? Is she there? Can you hear me, Madam Olubimi? How
Yes, sir.
can yes,
Yes, I can hear you, sir.
yes. This is important because
I said,
there are people who are going to contact you. So please tell us or tell the audience and the entire world how they can connect with you.
via WhatsApp, sir.
Okay.
Can you
Via my WhatsApp.
can you just tell us your contacts?
Yes.
For those people that will be interested to talk to you
Yes.
after this program and want to come
Right.
for consultation.
Yes.
Okay. 0812
0812, yes.
081 709
709
65
65
49.
49. Again, please.
Yes.
Again, can you call that number again, please?
You can follow me through my Facebook.
Okay. What's your
Okay,
Facebook?
what's your Facebook handle?
It's Arewa Dibe.
Come again, please.
It's Arewa Dibe.
Okay, so they've had you, the others have had you now, and I know they'll be joining you now and they'll be following you on your Facebook account. So thank you very much, Masolubume, for having you
Yes.
with us on the studio.
Also.
We really appreciate you. Thank you. Thanks for your time.
Thank you so much.
And we hope to see you next time.
Yes.
Thank you very much, Masolubume. Thanks for your time.
Thank you so much. Thank you so much. We really appreciate your time. And of course, we have Dr.
Dr. Oyelade Taiwo.
Yes,
He's a doctor in Ondo State General Hospital. He's in the Department of Emergency and Accident. So I remember the first time I went to meet him in the hospital and I saw a lot of things he's doing. I said, oh wow. So Dr. Oyelade Taiwo, you're welcome to the studio.
Thank you. I'm with you.
All right, sir. So can we meet you, Dr. Oyelade Taiwo? Can you tell us more about your biography and your family background?
Once again, good evening, everybody. I'm Dr. Oyelade Taiwo. I'm from the Sarea Akoko, Ondo State. Born in the family of Oyelade in Sare. So I'm married with kids. So I graduated from University of Ilorin in 2010 as a medical doctor. Since then, after my service, I joined the service of Ondo State Health Management Board. And since then, I've been in the Department of Internal Medicine for 3 years, Department of Surgery for 2 years. I was in accident and emergency for like 5 years. Currently, I'm in the Department of Ophthalmology. And the hospital is now Federal University of Technology Teaching Hospital, FUCA. So, Ondo State needed that hospital to federal government. Currently, Federal University of Technology Teaching Hospital.
All right. Thank you very much.
Fantastic. Thank you, Dr. Oyelade. Live today is Health Talk Show podcast, The Silent Killers. Of course, you had introduction of one of our guest speaker, Dr. Oyelade. Dr. Oyelade will be handling and sharing his knowledge and expertise on the field of health. Of course, one of those things is cardiovascular disease, and then of course hypertension and diabetes. So today, you guys watching us all around the world, do not forget to share, like, comment, because this is very important. A healthy person is a wealthy person.
Yes.
You have all the money in the whole world, you're not healthy. You're not going to enjoy the wealth. And that's why God said, "You wish above all, I will give you good health." So once you have good health, you have everything. So most of us are healthy. Only maybe do not have what they're looking for right now, but there are people that have what they're looking for, but they do not have health. Okay, so you need to listen to Steve Jobs, one of the lectures he delivered. I think at Harvard, I can't remember, it's Harvard University before he passed on. One of the great legends in technology, the founder of the Apple, was the health challenge he had. And he did not take it seriously until when the thing became so bad at the point of death. So he managed for some couple of years and then he regretted having allowed his health to fail him. Yes, he got promoted, which is Apple, that we are enjoying today, but he lost one thing, which is his health. This is important for us, the silent killers. Some of us do not have the resources, of course, especially in the third world, Nigeria, particularly, as a case study, we over 200 something, but we don't have very good health facility. So for us having Dr. Odolede speaking to us today is something that we're very happy about. And we believe we'll be having this thing happening regularly. So he will be speaking to us. So Michael, what is the questions or what are the audience asking regarding this thing called hypertension, diabetes, and the rest of them?
All right, thank you very much, my hosts. And there's a question from Yabo Mama Julie. Okay, the question says, how serious is the burden of hypertension and diabetes in Nigeria today? Dr. Olilade, how serious is the burden of hypertension and diabetes in Nigeria today?
Thank you, Michael. Well, the burden of hypertension and diabetes as the two most common causes of cardiovascular related disease and its complications in Nigeria is alarming, and the burden is very full from the epidemiological point of view. The reason being that, like hypertension, we said that 1/3 of the world population are hypertensive, just of the adult population. Let's say from 40 years and above. Let's say we can just to an hypothetical value. Let's say they are about 40 years and above. If we are about 60 billion in Nigeria, we say 1/3 of that population hypertension, which means about 60 billion hypertension. Out of this 1/3 that hypertension, it's only 1/3 of it are aware that they are hypertensive. It means that a lot of people are hypertensive, but they are not aware. You understand? If from the statistics we are quoting, if we say about 20 million of the adult Nigerian population are hypertensive from 40 years ago, and only 1/3 of those people that are, if they are 50, the 1/3, let's say 20 are hypertensive now. Only 1/3, that's the rule of third. Only 1/3 of those population are aware that they are hypertensive. That is, about 7 million actually is aware that they are hypertensive. So, and out of these 7 million that are aware that they are hypertensive, maybe only 1/3 of it are actually receiving treatment. So the burden of hypertension is huge in Nigeria from the epidemiological point of view. And I've just said one of the reasons, because the hypertension, the causes of hypertension in most cases is idiopathic, because it is unknown. And most of the hypertension we have in Nigeria, the causes, we can call it essential hypertension. That is, the causes is actually unknown. That is genetic. You understand? So, and what makes the, the burden very huge and serious is that at the beginning, hypertension, when you have hypertension, at the beginning, it is asymptomatic. That is, it will not give you any symptom or any sign. That is, you'll be hypertensive, you still be working, going out to work and come back. So that is one of the reasons why a lot of people do not take hypertension serious. And health, because of the habit, our attitude towards health in Nigeria and mostly in Africa is that we don't go for routine medical checkup. That's why diabetes and hypertension burden is very huge in Nigeria. So also diabetes. You can be diabetic for 5 years without any sign and symptoms, but and it will be damaging your body gradually, and it will not even notice. By the time you start having symptoms, the damage is already advanced. And because of our nonchalant attitude towards good health, we don't go for medical checkup. So it makes these diseases very serious. When you have malaria now, within few days, you'll be having fever, unlike diabetes and hypertension, that if the damage will continue without giving you serious symptoms or maybe a warning sign. A warning sign. That is why the burden of hypertension is very huge in Nigeria. Another reason why the burden is so huge is that maybe when there's another cause, then we'll try to highlight the other causes, because the treatment of hypertension and diabetes, the treatment is, both treatments are so costly that an average Nigeria um, cannot really afford most of the drugs, because diabetes and hypertension, you have to be on medication for your entire life. So an average Nigeria, because of the poverty level, cannot actually maintain continuous buying of medication just to maintain themselves.
Wow, that's a very scary situation that Dr. Olulede painted. One third out of, say for example, 100 million or 200 and something million Nigeria are hepatitis. So these things, does diet, let me take for example diet, does it has some kind of prevention measure to cardiovascular diseases?
Yes, you see, when we talk about the causes of diabetes and hypertension, we cannot but mention diet as one of the causes, because let's say we cannot but mention diet as maybe number two or number three causes. If we talk about maybe genetics, maybe someone is predetermined to having either hypertension or diabetes. Maybe someone has been predetermined, a person that has been predetermined that this person will have diabetes and hypertension. So the next causes we'll be talking about is diet. Yes, because there is a change in lifestyle now. People don't longer eat balanced diet. You see, take people take alcohol excessively, drink alcohol excessively, people smoke, then also you see people patronize all these fast food, eating junks. There's reduction in the eating of vegetables. People will go to canteen or all these fast food. They will eat meat pie. They will take coke. All these things contribute to having diabetes and hypertension. And you see this diabetes and hypertension, they are like brother and sister. When you see someone having diabetes, just give that person few years, that person will come down with hypertension. If you see someone having hypertension, few years, if care is not taken, the person might come down with diabetes. Though a person that has diabetes, that person, the ability to come down, the tendency to come down with hypertension is much more higher than a person that is diagnosed of hypertension. The person may or may not come down with diabetes later in life. But for hypertension, it is almost guaranteed that when someone has diabetes, it's almost guaranteed that 2 years to come, the person will have hypertension. And all these things can be traceable to diet. I've just said that people eat fast food. All those foods, they are not really good for body. The way people eat, some people they don't eat balanced diet. Some people will go eat red meat excessively. They will eat sugar containing, high sugar containing or non-refined sugar. They take coke, they take beer, then alcohol, then people go to fast food, they eat candy, a lot of all those something that are highly sugary. So they eat it. So when they don't eat food, some people for years they've not tasted food. Some don't eat vegetables then, and most of our local foods are very good for body, but people don't eat all those foods. So because of the way they work, so they patronize all these processed food. Most of the food that a lot of people eat, canned food, processed food. So people don't eat raw food. You understand? So this
Yeah.
diet is in conjunction with lifestyle. People don't exercise. Those people that have car, they go with the car. They don't do anything. So sedentary lifestyle, no exercise, nothing. You understand? So
Yes.
as year in, year out, then some person can develop diabetes and subsequently hypertension. So the role of diet in causing hypertension and diabetes can never be overemphasized. Then in the treatment too, there is no way we talk about treatment of diabetes and hypertension that we also will not talk about diet. So diet is an important diet and lifestyle. Both of them are important causes of both diabetes and hypertension. And most of these diets are from processed eating of fast food, processed food, eating food that have been prepared, all those canned food, most of them. So all these foods they cause can lead someone to having diabetes and hypertension.
Okay, thank you very much, Dr. Ojelade. Now, can we say now that the two major causes of hypertension and diabetes are lifestyle and diet?
Yes, we can say that in Nigeria now, because of there is a westernization, we are adopting Western lifestyle. So this lifestyle and diet, the type two, we have two type of diabetes. We have type one and we have type two. And type two is much more common than type one. Type type one. So the major causes of type one is just about diet and lifestyle. Some people the way they eat, you only eat when you are hungry. It doesn't you don't necessarily need to eat 3 square meal. You don't necessarily need to eat 2 square meal or 4 square meal. You should eat when your body demands for it. Some people when they eat in the morning, maybe by the time they are going, they can just buy meat pie and they eat the meat pie, they take coke. Before you know, you see someone maybe candid, they buy it and eat it. So on the big eating predispose a lot of people to having diabetes. By the time they continue to eat junk uncontrollably, then they start adding weight. They start from adding weight. By the time they are adding weight, they become overweight. Then diabetes join. And when diabetes come in, there's no way within 2 to 3 or 4 years that person will develop hypertension. I've said earlier that hypertension and diabetes, they are they are like brothers and sisters. They like to coexist a lot. They like to coexist a lot. So that you can even say that the two most common causes of diabetes and hypertension are the diet and lifestyle. When some
Fantastic.
people they take alcohol, they smoke cigarette, all those things contribute, all those things damages blood vessels, then which later leads to hypertension.
Okay, thank you very much, Doctor.
Yes.
And someone is asking Dare Metaloka. Okay, he's asking that. He said, what blood pressure numbers are considered normal, pre-hypertensive, and high? What blood pressure numbers are considered normal, pre-hypertensive, and high?
Okay, the normal blood pressure is, it's a range. It's actually a range. So the normal blood pressure to actually be between one between 90/60 to less than 140/90. It's a range. You understand? So there is not a fixed number. We cannot say the normal is 110/70. No, the range it should be between 90/60 millimeter of mercury to less than 140/90 millimeter of mercury. However, at times when you have a blood pressure of 130, that's over 85 or even over 90, we can call this one the hypertensive stage. You understand? For such person, we counsel them, we monitor them, we give them short appointment in the hospital. Then we do dietary counseling. But when someone now has a blood pressure 140/90 millimeter of mercury on 2 occasions and consistently on that 140/90, then you can now say that this person this person is hypertensive. Then we can now say this person has hypertension.
Okay. Thank you very much, Doctor. And I have another question with me here from Chukwuemeka. He's asking that what warning signs of heart disease should not be ignored? He said, also, what are the early signs? What are the symptoms of diabetes and hypertension?
Okay, thank you. Well, we have a lot of warning signs of heart disease that should never be ignored. Number one, if you are having palpitation means awareness of heartbeat. When you start perceiving your heartbeat, please don't ignore it. You need to seek doctor's consultation. That's number one. Then number two, when you are having a left-sided chest pain, radiating like a tightening pain from the chest in the left side, please, it might be a warning sign to a grave cardiovascular disease, which is called angina. Understand? And this angina is a spectrum. We have mild, moderate, and severe. The severe one
Yeah.
is called myocardial infarction. So those signs should never be ignored. So by the time you start having noticing the awareness of your heart, the palpitation, that your heart is beating fast, please you need to consult a doctor. Then when
Okay.
you have left-sided chest pain, you need to consult a doctor to be able to be able to be sure that this pain is not actually coming from your heart. Then
Yeah.
also um at the initial stage, the the hypertension is asymptomatic, that is, you not have any symptoms. By the time you are having a symptom from hypertension, it is actually a symptom from complication. Headache, severe headache, you understand? Headache,
Yeah. Yes.
palpitation that I've just said,
Okay.
then but weakness on one side of the body. It might be
Okay.
an imminent stroke from an hypertension.
Wow.
Then when you see a leg swelling, it might be a sign that the hypertension has started damaging your heart or even your kidney. If you are having leg swelling, both foot swelling, it might be from that your heart is being damaged or your kidney is being damaged. Then also infatigability. Some people, they cannot walk from one pole to another pole. They get tired easily. They feel like take a rest.
Okay.
So infatigability is also a sign that there is a cardiovascular disease. You know, when you talk about cardiovascular disease, it might be that maybe there's a problem to your heart, there's a problem to the brain, there's a problem to even the kidney. These are the cardiovascular diseases from hypertension and diabetes. Then
Okay.
also, let me even tell you something. If you're having blurry vision, that you cannot see very well, you that normally that you have sharp vision, and the moment that your vision becomes blur, it might be that the hypertension or diabetes is continuing to damage your eye, because
Okay.
hypertension and diabetes, they are systemic diseases. They damage every part of the body. If you're having numbness of both hand and feet, the numbness of hand and both feet, as if there is no blood, as if the blood is not getting to that place, we call it paresthesia. So it might be a sign of either
Doc-
diabetes or hypertension. If you
Doctor,
have a
can you
wound,
please recall? Sorry, sir. Can you please recall what you call that again for
Yes.
people that are watching us live now? What did you call that again?
okay, we call it paresthesia, that is numbness of the fingers, numbness of hands and feet.
Okay.
The way they explain it is that it is as if the blood is not getting to that place, or as if you are having 1,000 needle um, pain, as if there is a needle pain, like multiple needle pain, as if the blood is not getting there. You understand? We call it
Yes.
paresthesia. That is, the English name is numbness. People say as if the blood is not getting there, that the pain is disturbing. It's not that it's not a severe pain, but it's disturbing. I think you can, at times you can't explain the way the hand feel and the leg. That's as if they are choking 1,000 needle on your hand and your leg. So we call it paresthesia. In most of the cases, it is when patients start complaining that it is advanced hypertension and a long-standing diabetes. Understand? So
Yes.
that is also one of the symptoms. Then I've talked
Yeah.
about when you are having headache. I've talked
Yes.
about weakness in one part of the body, that is
Yes.
imminent stroke. So those are the signs. Then easy fatigability, when they walk, they get tired easily. Then another, for diabetes now, you can have excessive urination. You understand? We call it
Yeah.
polyuria, excessive urination. You'll be urinating much, the frequency will increase, then the volume of what you urinate is also increased. Understand? Then, and you feel thirsty. As you are urinating, you feel like drinking water. Then there is also polyphagia. Then you continue to, you will be eating. Then as you eat, then you continue to lose weight.
Wow.
You
This
understand?
is
You are
this,
eating and you are also losing weight. So most likely it is a sign of diabetes or
yes.
symptom of diabetes.
Yes. So these things are there cause something, could the environment cause some of this uh, cardiovascular disease, or probably hypertension or diabetes?
No. The environment at least. No, the hypertension and diabetes, the causes is not about environment, it's not about climatic change, nor it
Okay.
is not about environment where you stay. It is about
Okay.
diet and lifestyle.
The diet and
Understand?
life.
Yes, it's about diet and lifestyle. It's a non-communicable disease, and it
Because
is not due to weather.
okay.
They are not, it's not, they are, both of them are not disease that is related to a weather or climatic change or the environment where you stay. It's just about lifestyle. If you are in America and you don't, and your lifestyle, if you are in, whether you are in America, whether you are in Nigeria, Australia, UK, anywhere you are in the world, if you have the same lifestyle with someone that is America, Europe, then both of you, because of that diet and lifestyle, both of you are predisposed to having either hypertension or diabetes.
Thank you, Dr. Oyelade. Our listeners and audience around the world, what you are hearing today is something that people pay a lot of, in millions and thousands, depending on the currency you're using. But Dr. Oyelade is doing this for humanity because of the passion he has for lives. And then to be able to prevent some diseases that are preventable. You've heard it, lifestyle, diet, and and what?
Lifestyle and diet.
And diet. These things are the cause of some of the three um, diseases that he handled professionally. Dr. Oyelade, can you tell our audience, your audience, and then your colleagues around the world, how they can connect with you? Somebody might probably need private consultation or medical consultation. Then those who are going to be watching, streaming us live, watching us live, so that they can contact you. And we hope that we will continue to have you. We cherish this place. And you tell them how they can reach out to you.
They can reach out to me via my phone number or email address. So my
Okay.
phone number is 080
Okay.
625
957
957 08.
95708. Again, sir.
080
080
625
625
957
957
08.
08.
Right.
What
Your
about
email
your
address.
My email address is oyeladetaiwosaid@yahoo.com.
Can you spell it?
Oyelade, OYELADE
Yes.
CAIWO
Yes.
SAHEED.
All right.
All right. And then without being said, we want to thank you, Dr. Oyelade, for you to spare your time today to be with us on our YouTube channel, streaming live. We will be glad to have you again. And this is a very short notice, and you jump into the call. We appreciate you. We want to say thank you on behalf of the TD studio, the whole crew, and my co-host, Mr. Michael Oyelede, myself, Mwale Tucci, and of course, Mary is behind the camera, and then Vicky. I want to thank you so much. God bless you. We want to send our regard to your family. And our listeners, you heard it, lifestyle, diet. Please let us take our health seriously.
Yes.
What you mentioned here blew my mind. Blew my mind. I'm very serious. There are a lot of things we take for granted out of ignorance for health. And then those practitioners, when they spend their time to tell you about your health, it's a time for us to think on what we consume, even some of our consumption. Yeah, so he made mention of it. Those junk food, those things we take, eating very late, and all of that. Smoking, alcoholism, all of those things contribute to what we're talking about here. Let us not kill ourselves too early when it is not God's time. I want to thank you for listening, and do not forget to subscribe to our YouTube channel, and then like, follow, share, comment. Thank you so much.
Thank you.
Thank you. Thank you for the privilege.
Thank you, sir. God bless you. Have a
Thank
good
you,
day.
sir.
Thank you.
Thank you. Please, the take-home message is please let us have the habit of medical checkup. Let's just try and check and do medical checkup at least once in a year. Thank you for this opportunity.
Thank you.
Thank
God
you very
bless
much,
you.
Doctor.
Thank you, Doctor.
Thank you for having you.